name's Liv. I'm a technician here in the ER at DLEAH. I'm going to show you how to do a blood draw on a medial saphenous vein, particularly on a cat. This is Wrigley. He might be a little bit squirmy, so that's why I have an extra person to help kind of distract his face. That can be really helpful. Also helpful to make sure that your restrainer knows how to restrain for this particular blood draw, because there's a couple things that go along with it. So I have Tara here holding his front legs and back legs. Basically, she's gonna hold the tail. Gonna hold the tail and the foot in her hand and kind of karate chop the leg so that I can go for that medial saphenous vein. I do have to get quite a bit of blood because we're sending this out for a senior panel, so bear with me. I'm going to start by clipping the area. Based on the patient's anatomy, I would assume that the vein's going to be in this area, and it is right there. I'm going to go ahead and put some alcohol. I'm right-handed, and so I'll use my less dominant hand to hold the paw and then my right hand to draw the blood. You can draw the blood with a syringe and needle or with a butterfly. It's truly personal preference. I'm going to use a butterfly. I'm using a 23 gauge, which is generally what I use on cats usually. So now that the vein is being held off and I have alcohol and shade, I'm going to go ahead and poke for my blood draw. So if you've never used a butterfly before, you're going to start by holding both of the wings like that. And you want to make sure your bevel's up, as always. And I'm just going to go ahead and attempt to get that into his vein. Okay, so we do have some blood coming back. I'm going to draw back. It looks like maybe I came out of the vein a little bit. So all I'm going to do, oh, there we go. Yep, so I just moved my needle just a little bit, just a smidge, and we are flowing pretty nicely now. Something that I do also like to do with these kinds of blood draws with this setup is when, ooh, it's okay, you're baby. Okay. I know, honey. Wiggle worm, wiggle worm.
You're okay. You're okay. You're okay. You're okay. You're okay. You're
Are you still bleeding?
Mm-hmm. We're good.
Slowly but surely. Okay, he got a bit squirmy there, but it looks like we are still flowing, so I'm going to keep that going. Basically what I did without explaining it was, once my blood kind of got really close to the hub of my syringe, I took my syringe off and then pushed it back so that I didn't have to deal with a bunch of air in my syringe when I go to put it in my blood tube. Sweetie, I know, honey, I know.
You're okay.
Sorry, baby.
You're okay. I'm sorry.
No, you're totally fine. All right. Looks like we're not bleeding a ton more, probably just because of him getting squirmy, and I think his veins collapsing a little bit. So I'm going to go ahead and pull out, give him kind of a break. First thing I'm going to do is get a Band-Aid on where I poked him so that his vein doesn't blow and it doesn't start bruising really badly. I'm going to go ahead and draw this back, and I'll go ahead and put it in one of my blood tubes. I make sure that I take it off of the needle when I put it in a blood tube, because if you try to push blood through the needle, sometimes it can lyse the cells in the blood, so it might not give a completely accurate results when you run the blood work. Another thing that, obviously, if you have any kind of anticoagulant in your blood tube, you do want to make sure that once you put the blood in, you pretty quickly cap and invert it so that it anticoagulates with the anticoagulant. That would be, for example, that would be this purple top, which is has EDTA, but so far I've just put blood in my serum separator, and so that is meant to clot, so I'm okay with it just kind of sitting there for now. All right, that's all. Thanks for coming.